Welcome back. If you find yourself constantly looking for your glasses or the idea of contacts as wearing thin, then this segment may be just for you. Dr. Mathew Sharpe from SharpeVision MODERN LASIK and Lens says refractive lens exchange might be an answer. Hello, doctor.
Hello, Kelly. Thanks for having me on today.
Yes, thanks for being here. And so RLE, Refractive Lens Exchange, explain what that is. And you have a nice little model here.
We have a little model here. So refractive part of it means glasses. So if you have nearsightedness, astigmatism, farsightedness, or presbyopia, we can replace your lens, so that's the lens exchange part of it, and put a customized lens into your eye so that you'll see perfectly both distance and near and not need reading glasses, not need distance glasses. And the kicker is that you will never need cataract surgery because you've already had the lens of your eye replaced with an artificial lens that stays in there the rest of your life. So refractive lens exchange does just that.
That is mind-blowing. So with the model, what would you be showing us today on how that exactly works?
Let me show you what that is, because in our eye, and a lot of people might not even know that they have a lens that's about the size and shape of an M&M chocolate candy. And that lens is clear and flexible when we're born. And then in our 40s, it gets to that point where it's no longer flexible. So you'll need either glasses for distance, near, or both.
Right now.
Yes, exactly.
I know. Okay.
And as it gets less flexible, then everyone has to have glasses for something as they get older. Over 45 is about that age. So what we do is we take that lens through a tiny incision that's invisible. We remove the lens and then we replace it with an artificial lens. So I'll show you kind of what that artificial lens looks like inside the eye, and it's placed inside there right where that lens existed to begin with, and then that focuses the light for you at distance, at near, and then because you've had the lens replaced, no more cataract. So a cataract lens looks something like this. It's as we get, so it gets less flexible in our 40s, but in our 60s and 70s, it gets less clear. And at some point you say, well, I can't see through that, but you might have to wait for insurance to pay for it till you're 75 or 80 years old. And what refractive lens exchange does is say, let's bypass that by 20 years so you don't have to wear glasses from 45 to 65 and wait till insurance will pay their small bit.
How long does a surgery like this take? Walk us through that process.
Well, that's the amazing thing. So the process is first you'd come in for an exam, we'd take measurements of your eye, explain it in greater detail, answer all your questions. But the procedure itself is done at our state-of-the-art surgery center in Bellevue, and we put a little bit of medicine under your tongue, which makes you very relaxed and loopy. So there's no needles, there's no IVs. There's no putting you to sleep, but you're very sleepy, and a lot of times people don't even remember all the details of it. It takes about 5 minutes, it's painless, and we simply use a laser to make all the cuts and everything in there, then go inside the eye, remove the natural lens, and replace it with this very flexible artificial lens. So the lens, this one's a little bigger, but this is kind of what the lens looks like.
Incredible.
And it goes, it's flexible, so it goes in through that tiny incision, opens up, stays in there the rest of your life. So you never need to replace it or clean it.
It's so nice to think about that you can go in one time and then you're set.
That's the beauty too, is it's one and done. There's no astigmatism, nearsightedness, farsightedness, or reading glasses. And then you don't have the worry of, well, I don't want to have that surgery when I'm 80. Do it at 50 or thereabouts, and then you don't need any more surgery the rest of your life, and you can see clearly, no glasses.
That's so amazing. And are there any risks then that people should know about?
Of course, there's always risk. Any surgical procedure has a tiny risk of infection, inflammation. Your vision typically after the procedure is a little foggy the next day, but for instance, I had a childhood friend do this in June and was 20/15 uncorrected the next day, could see tiny print up close, and is just thrilled with the results. And so there's always follow-up, and we'll make sure everything goes okay, but there's very low risk.
Incredible. And I want to know why SharpeVision, of course.
Well, I think SharpeVision is as good as any practice in the country. We have a Medicare certified ambulatory surgery center that's set up just for eyes. So we don't do hip replacements or any other procedures. We do just eye surgery, and we have the latest equipment. Our surgery center is about 18 months old with absolutely outfitted just for eye patients. So usually they can come in and go home within an hour. For the refractive lens exchange, we usually do both eyes at the same time, so you're in and out in about an hour.
Incredible, doctor. Thank you so much for being here. This was so insightful. And you can schedule your free comprehensive consultation online at sharpe-vision.com right there on your screen.